Today I stand before you with greetings from the Coordinating Minister of Health and Social Welfare. I stand here with immense pleasure and a profound sense of purpose to announce a significant milestone in our commitments towards safeguarding the health of our nation's future. On October 24th, 2023, we will mark the national launch of the human papilloma virus vaccine for girls aged 9 to 14 years in Nigeria. This monumental initiative is spearheaded by the Federal Ministry of Health and Social Welfare through the National Primary Healthcare Development Agency, with support from NAFDAC, community-based organization, several stakeholders, including our esteemed partners, traditional and religious leaders. The introduction of the HPV vaccine is not just a medical advancement, it is a profound leap forward in our mission to protect the health and aspirations of our young girls. It empowers them to lead healthy lives and become the formidable women and mothers of tomorrow. Human papilloma virus is a commonly transmitted infection that is a silent harbinger of several types of cancers, including cervical cancer. Tragically, cervical cancer stands as the second most common cancer among women in Nigeria and the second most common cause of cancer-related fatalities among women aged 15 to 49 years. Nigeria alone contributes an estimated 12,000 new cases of global cervical cancer annually. HPV infection has been identified as a high-risk factor implicated in 95% of cervical cancer cases. With 12,000 new diagnoses and 8,000 lives claimed each year, it translates to 33 new cervical cancer cases and 22 deaths every day in our country. In Nigeria, one precious life is lost every 2 minutes to this preventable disease. Regrettably, this insidious disease ranks among the leading causes of cancer-related deaths in 36 countries, including Nigeria. This is why the introduction of the HPV vaccine is a beacon of hope in our relentless fight against the burden of cervical cancer. By immunizing girls at an early age, we aim to shield them from the most common HPV strains responsible for cervical cancer later in life. The HPV vaccine has been scientifically proven to be safe and effective in preventing HPV infection and reducing the risk of cervical cancer. To stand here with the DG of NAFDAC and our partners and donors to share that this vaccine will be provided free of charge to all eligible girls in Nigeria commencing on October 24, 2023. Many countries, both in the Western and African regions, have already integrated this vaccine into their immunization schedule. The proactive introduction of the HPV vaccine in Senegal in 2018 resulted in a remarkable 90% reduction in high-grade cervical abnormalities among vaccinated women, demonstrating the vaccine's undeniable effectiveness. Similarly, in Ghana's commitment to vaccinating against HPV, she has achieved an impressive coverage of 99.5% and 94.7% among eligible girls. However, while vaccination is the most potent prevention measure against the human papilloma virus, we strongly encourage women to undergo regular screening tests for early detection and prompt treatment. Over the past several months, the Federal Ministry of Health and the National Primary Healthcare Development Agency, in collaboration with our partners, community-based organizations, and the media, have diligently executed a comprehensive plan to introduce the HPV vaccine. We have bolstered the capabilities of our frontline health workers, ensuring that they are adept at ensuring that our health workers are adept at administering the vaccine. Alongside our partners and donors, we have secured over 6 million doses of the HPV vaccine and essential supplies. We have conducted numerous fora to raise awareness among stakeholders, including parents and caregivers, regarding the pivotal importance of HPV vaccination. To address any concerns or misconceptions, we have engaged with communities and established a robust monitoring and evaluation framework to measure the impact and progress of the vaccination campaign. This vital introduction will occur in 2 phases. The first phase will encompass 16 states, namely Abia, Adamawa, Akwa Ibom, Anambra, Bauchi, Bayelsa, Benue, Enugu, Jigawa, Kano, Lagos, Nasarawa, Ogun, Osun, Taraba, and the Federal Capital Territory. The second phase is scheduled for the first quarter of 2024 and will encompass the following states: Borno, Cross River, Delta, Ebonyi, Edo, Ekiti, Gombe, Imo, Kaduna, Katsina, Kebbi, Kogi, Kwara, Niger, Ondo, Oyo, Plateau, Rivers, Sokoto, Yobe, and Zamfara states. In each phase, we will initiate a 5-day campaign encompassing schools, communities, marketplaces, government-owned health facilities, and other public places, targeting girls aged 9 to 14 years. Subsequently, we will continue routine vaccination within the health facilities for the same age group. By 2025, we anticipate transitioning to full routine immunization with the HPV vaccine, focusing on girls aged 9 years. I extend a heartfelt plea to parents, caregivers, and guardians to seize this opportunity and ensure that their daughters aged 9 to 14 years receive the HPV vaccine. In doing so, we are not only securing their health, but also making an indelible contribution to the reduction of cancer in our society. I call upon all influential figures within our communities, from religious to traditional leaders, community leaders, school proprietors, civil society organizations, and our esteemed partners in the media to join us in championing the advantages of this vaccine. We recognize that the success of this initiative hinges on your unwavering support and collaboration. We implore all Nigerians to embrace this opportunity to protect our girls from cervical cancer, as the HPV vaccine is a safe and effective means of cancer prevention. Our dedication extends beyond the mere introduction of vaccines. In tandem with the rollout of the HPV vaccine, we are actively championing the cause of early screening and proficient case management of cervical cancer. This holistic strategy is designed to facilitate the timely identification of the disease, thereby affording women the most favorable odds for successful treatment and recuperation. Our objective is to ensure that 90% of our young girls receive complete HPV vaccination by the age of 15. 70% of women undergo high precision screenings at both 35 and 45 years of age, and 90% of women identified with precancerous conditions receive appropriate treatment. Distinguished ladies and gentlemen, today marks a significant milestone in our journey, but it is only the beginning. We envision a future where no woman needs fear the harrowing consequences of cervical cancer, a future where we can proudly declare victory over this disease, securing the health and well-being of our women and girls. We cordially invite each and every one of you to join us on October 24, 2023 for the national launch of this momentous initiative. Your participation will not only emphasize the profound significance of this undertaking, but also provide an enduring wellspring of inspiration and motivation for all stakeholders engaged in this endeavor. Together, we have the power to make a difference. Together, we can protect our women and girls. Together, we can conquer cervical cancer. In conclusion, I wish to express my profound gratitude to NAFDAC for making sure that all of the detailed processes that are required to approve these vaccines for Nigerians was done within record time. I also want to express our profound gratitude as a partnership to Gavi, WHO, UNICEF, and all of our partners for their unwavering and tireless work alongside government at every stage of this process. As we enter the next phase of our journey, let us remember that every daughter we protect today is a beacon of hope, a testament to our collective resolve to prevent suffering and save lives.